Okay, so we're going to begin our first lecture on the integumentary system. You'll kind of see me, I have a couple bullet points and notes in the book with highlights and all that. So I'll kind of be looking around just a little bit to make sure that I get the points as I mentioned in the orientation, because this is how I'm going to be constructing your quizzes, your tests, so that they go together and as they should, in my opinion. And as I had said earlier, of course, please read the entire chapters. It's not that I don't think anything is not important, but I'm just focusing on certain things that I think, and I think as I'm going through, you'll kind of see where I'm going. So for this particular chapter, which is chapter 53, which is entitled Integumentary System Function Assessment and Therapeutic Measures. So I think a lot of the time when we think of integ or integumentary, and even myself, I always think of the skin. So keep that in mind that it's not just the skin that constructs of the integumentary system. There are actually several different components, because obviously the skin can't stay alive without blood vessels, right? We have glands. Some other things I wanted to mention was your hair, your nails. Those are all components that make up actually the integumentary system. So you have the integumentary system, which is obviously everything that I just said. Most of you do know that your skin is your largest organ in your body, or not in, but on your outer part of your body. So with that just being said, I can imagine how, obviously all of our organs are important, and some we can't live without, some we can. Your skin is very important. It's a huge part of your body that it's protecting you from the outer world. And I really want to stress the fact that what is normal versus what is not. So as I said in the orientation, as nurses, no matter where you work, we want to know, okay, yes, I work, let's say in a pediatric clinic, for example, and I'm usually there doing immunizations and, vital signs, and that's my job as an LVN, and it's great. I love it. You get to talk with the kids, but mom, may mention, oh, there's this rash right here, this, that, the other. Are you able to assess it? What are the terms that you're going to use to speak to the physician? Do you know what a certain word means? So why I'm mentioning that, number one, you always want to know abnormal from normal. Obviously, we know a rash is not normal. More than likely, it's very rare that it's going to be catastrophic to the point of death. However, it can be. So, these are things you can really catch. It could be as simple as me saying, hey, look, I have this little thing right here. And then you forgetting to write it down and them not mentioning to the doctor. And it's like, ends up being this huge, unfortunate thing called, it's the thing that, totally blanking out at the moment, but it can basically eat your skin. And your skin, obviously then can turn into a huge infection, and depending if you're immunocompromised or if, you just aren't in good health anyway. So these are all things that we really want to pay attention to. Okay. So the reason I'm mentioning all of that has to do with the key terms. So at the beginning of each chapter, you're going to see in this nice little like bluish color key terms. So as I had mentioned, I'm going to kind of not say hint, hint, but when I mention things, please listen when I'm lecturing. This is actually going to be probably the shortest lecture. Number one is the first one. We're easing back in, la, 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 la. And it's pretty basic. So I'm just going to tell you what is important for you to know. And of course explain it, but this is kind of I hate to say it, it's more of a memorization one, other than understanding the importance of why you need to know it. So please always look at the key terms. I think the key terms are important. I think it's important for you to know, what is alopecia? What does that mean? If you have a patient that comes in with alopecia and they don't have any hair or eyebrows or hair on their body, and you're like, oh my God, it's cancer, it doesn't mean that the patient has cancer. And that's another part about sensitivity and understanding what's going on and what's going on with the follicles of the body, because remember, I just said hair is part of the integumentary system. So please take a look at those words, skin turgor. There are certain ones you'll know because we talk about them all the time, but then there might be some other ones that you don't know. Bruising, different types of, you'll see as you go on, but I found them to be important. So you may see them come up on a test. You may see them come up on a quiz. Just understanding those words. There's usually not very many. I did look through the chapters. But terminology, I think, is very important, not just because it does help us. You don't want to walk up to the physician or NP or another nurse and say something that doesn't sound articulate, or you don't want to document something that isn't a correct documentation, because remember, documentation is very important. And you are intelligent and you should know the words, right? Okay. So that's another part that I wanted to point out. So the skin itself, like I said, is an organ. So obviously we have an outer and an inner layer. I will want you to please take a look on page 1146 if you have I'm assuming you probably all have the newest edition of the book. So on page 1146, it does show very specifically the epidermis, the dermis, and then like the subcutaneous layer. So you know that because you give injections. So obviously you know how deep to go for a muscular injection versus maybe a sub-Q, but it's a very good reminder. It has really good animations on it. So I really want you to take a look at it. I'm not saying I'm going to test you on it, but if I ask you, for example, you don't need to know the shaft is the exact part of the hair that extends above the skin surface. I don't care. I mean, in the big picture of things, how is that going to help me in nursing? So constantly think, how is this going to help me in my nursing career? So if I were to give, again, we're in peds. Okay, so we'll just use peds. Sorry, I'm getting sick. Negative corona, yeah, COVID, sorry. But I'm having allergies or something's going on. Maybe it's the fires, so excuse me. So if you're going in and let's say you're going to be doing something on a 15-year-old male who's there and he wants to do volunteer work, and in order for him to do that, he has to get a tuberculin test on the forearm. And the parent might ask, or the 15-year-old might ask, what are you doing? Okay, well, I'm injecting a non-live virus into your skin. It would be nice. I mean, of course you would say skin, but I would let them know it's the very, very top of the skin, especially if they're scared of needles. That's even better. Yay, I can explain. I'm going into the very, 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 you can explain to them that, what part of the skin that actually is, which, and how deep and whatnot. And you can use whatever terminology you want, but you should know that. And just like you should know how deep you're going when you're going through the skin, when you're doing an IM, you're going into the muscle. So you have to go through all layers of the skin in order to get to the muscle. So again, it's that big picture. It's putting it together, why you're doing it, and how it's working. So all you need to do is just take a look at page 1146 and just understand that there are different layers of the skin. There's outer layers, there's, I guess you call them medium layers, and then there's inner layers. So just if you can do that for me, that would be great. Another thing that I thought was really important is understanding the difference of how we produce new skin, because we do produce skin a lot, right? So how often do we produce skin? How often are we shedding skin? Sounds interesting, I know. But, what does the word mitosis mean? That might be important. What does mitosis mean? What does that mean? Why does that matter? And the protein keratin, I think, is very important and is talked about actually a lot in the community. And as a healthcare professional, I think would be something very important to understand and know. So understanding the word mitosis as well as keratin. And then something that is more of like the nursing critical thinking aspect of all of this has to do with the bottom of page 1144, where it talks about where the skin, if you have skin that has basically broken. So let's say you have a patient who is in a skilled nursing facility. I don't care how old they are, but we all know, unfortunately, the older we get, usually our skin will, become thinner and it's more vulnerable to tears, and we have to be more careful. And we've all seen it. We've all talked about it. I think we understand that. But again, it's about putting it together. So why is this important? So why is it important? So another key term here is, and I'm not perfect, and you all know that I'm not good with words anyway, but the stratum corneum, it affects the effective barrier. It is the effective barrier against pathogens and chemicals that basically go through the part of the, basically it's the protective barrier of your skin so that things cannot get in. So I think that would be important to know. You may not need to know the exact word, but you should know, I think, that it is important that your skin has a protective layer that will actually protect it from barriers, hopefully in a sufficient way, unless it breaks, right? So imagine, again, someone laying, it's going to break down the skin, and unfortunately pathogens are going to get in the skin, and we don't want that because what can happen? Infection. And what did we just say about the skin? The skin has many layers, and then what does it go to? The muscle. And that is not something we don't want an infection anywhere. But then if we get down to the muscle, what's underneath the muscle? The bone. So it's so important to take care of that outer part. Then, oh no, something's happening. Let's take care of the middle part and then the deepest part before we get to that. Because once we get down to that part and we get an infection in the bone or even in the skin, depending on the person, that could be something that could be very critical and life-threatening. So please keep that in mind, just as the bigger picture of nursing in general and why the skin. I mean, we all know the skin is important, but really understanding why. And in third semester, that's why I'll mention certain words here and there, but it's more about putting it together. Okay, what is melanin, or what is this, or what's that, or why does it matter? This is why it matters, and then we connect it to a story, like, oh, this person in a skilled nursing facility, right? Okay, so the words that I find important here are the key terms: mitosis, keratin, and the stratum corneum, which I'm not the best at pronouncing. And as I had just said, the bigger picture is we're always going somewhere with something, or in a lecture, it should always be going somewhere. Like, where is this going and why does it matter? Okay, am I just going to memorize this? This is not medical terminology. Where is it going? So why is it important for me to know, for example, we had just talked about this part of the skin. And right here, it talks about third-degree burns. Okay, so the loss of large portions of the stratum corneum, as with extensive third-degree burns, greatly increases the risk for infection and dehydration. So that's why it's important to understand it. That's why it's important to know. And you don't even have to ever, in my opinion, you don't have to remember that exact term, maybe for a test, but knowing that there is a particular layer of the skin that is very important, so that if you were to work in any part of a hospital, clinic, wherever you are, wherever you end up, or in the RN program or your master's program or whatever, or a family member or yourself, that we are given this part of our body to protect us from that. And we do talk about burns in chapter 55. So this is going to come back. So again, remember, I'm all about the connections, right? How are we going to make the connections? So that is a huge connection. So now you know the terms from this part that I find very important. The next one would be melanocytes, which have to do with the protein melanin. I think that you should take a special term on that. And that's because it has to do with cancer. And when you hear the word melanin and all of these terms, we tend to think of color. So different colors of the skin. And what pops in my mind, I don't know why, it's still from med-surg when I was at Mission College, is cancer. It pops in my head because I think of the melanocytes. So basically the more, cancer on that side, but melanin, which I think most people understand, has to do with if you're exposed to either like a tanning bed with like UV lights or the sun, melanin in your skin as well as your hair will lighten, basically. So that's why we have all colors and all different types of different colors, depending on, even if you're the same race, you could be a different color because you don't expose yourself to the sun as much, or it could be a genetic component, all sorts of different things. But a teaching tool there, which I would keep in mind, if you're with a patient, if you notice that they might look, it's not always pertinent that you can tell if it's maybe there's a fake tanning lotion you can use, or maybe they just happen to be a certain color and they just look tan, but that's actually the color of their skin. But there's no shame in asking. I actually remember myself, I was probably 20, 23, and I would use if you haven't noticed, I cover my body a lot. I don't like to expose my skin to the sun because I'm trying to protect it from cancer and aging, right? Because it breaks down your cells and the elastin in your skin. Many things do, smoking as well. And the doctor actually asked me because I had, I think, capri pants on or something like that. And she had asked me, she's like, oh, and did some education about, without even asking me first. And this is why I'm mentioning it too. Don't just assume, right? Ask your patient, oh, I noticed that you appear tan, or you use whatever language you find comfortable with, or ask them, do you expose yourself to any sort of outdoor tanning or tanning beds? Get the information before we assume. That's always what I try to do, at least with my patients. And then it's okay to give the information. A lot of the time at age 22, 23, like, oh, I'm never going to get old or whatever. But that's our job, right? Just give them the education, information. And if they seem like potentially reluctant, or even if they don't, I would still give them proper information on wearing as much sun protection as possible. And that's all you can do. And then you can document it and hope that you did something to hopefully help them not get skin cancer, because it is really prevalent. I don't know the exact statistics, but skin cancer, especially for men, I mean, I've noticed a lot lately on like the forehead, or if they're balding on their head, because it's out there in the sun if you're not wearing a hat, and maybe sunscreen is not being worn. So just as a side note. Okay, so what is something else that I think should be important? It should be important for you to remember the exact first thing I said. What composes the integumentary system? Literally says it right here. The skin, obviously, your skin, and you don't just the skin. Hair, nails, receptors, gland, and blood vessels compose the integumentary system. Blood vessels, of course, because you can't have a live tissue without having blood. And what does blood bring? Oxygen, right? So I think that is something that you need to keep in mind, that your hair, nails, receptors, glands, and blood vessels, and obviously your skin, are all part of the integumentary system. Very important to know, because I do think we tend to forget the other ones. We just think skin, skin, skin. And if you're following along in the book, I wish I would have asked you in the beginning. Sorry, please follow along in the book usually if you're watching the lecture. Just because I go in that sequence, and then I have like highlights, so you can see like highlights and kind of notes, so that I know what I felt was important, so that when I'm making the tests and whatnot, that things correlate. So on the top of page 1145, I'm not expecting you to understand, okay, obviously I think you should know what layer of skin, epidermis, dermis, subcutaneous, like I think you should know the layers as far as like the major 3 layers of skin. I think that would make sense as a nurse, but I'm not expecting you to look at the top of page 1145 and basically tell me, I mean, there's what, like 10 different things here, the active myelin muscle and this and this and this and that and whatever. That's not what I'm looking for. I'm not looking for memorization. That this is, I know it's, no, I'm not gonna say I knew this is LVN. No, LVNs are critical thinkers. It's just not important for you to understand, or I'm sorry, memorize every single detail. Certain things I think are important because they lead to something else, and that's what I'm saying. So please I don't want you to sit here and stress and be like, oh my God, I have to understand every layer. Which one comes first? No. So pretty much ignore the picture on page 1145 on the top. I'd like you to more focus on the picture on page 1146, and more of, this is what's really important, is the epidermis, dermis, and subcutaneous layers, knowing obviously which one's on top, which one's in the middle, and which one's on the bottom. And if you were to give an injection, where would it go? Okay. I'm actually gonna write that down. If injection, where? Because that's important for many reasons. Medication, if you put it in the wrong layer, I mean, if you put insulin in the muscle, it's not gonna work. It's inactive. It won't actually do anything. So these are important, obviously, for patient care, right? Okay, so the next thing has to do on the bottom of page 1146. I think this is important. For example, it talks about different types of glands. And again, as I had said earlier, I think that glands and blood vessels and things like that may not be your hair and nails, might not be like the first thing you think of when you think of the integumentary system. So I want you to just, take a look at the different types of glands. I'm not saying you need to memorize them, but like you don't need to necessarily memorize the glands. The one gland I would like you to actually understand, because it is brought up a lot. And again, sorry, I keep saying it again. Since I do actively work, and again, I don't care where it is, and I'm in school, actually, both, I can see what they're focusing on, so I'm trying to kind of follow suit. That's kind of where I'm coming from. And please keep in mind, I'm going to write this I don't know if you'll read it or not, or if you'll even watch this video. But this is my first lecture actually giving it on Zoom. So as with anything, and to be honest, this is kind of a dry subject. So I'm going to do my best. It's not going to be a fabulous lecture of, exciting things and movies and then talk about it and examples. I'm more giving you what you need to get. We're kind of learning as we go along on the first section, which is kind of almost why I'm glad it's a little bit bland. So with that said, it doesn't mean it's not an important system. I'm just pointing that out. So what I would like you to pay attention to on page 1146 of the glands, other than on the top where we talked about, the different layers, the epidermis, the dermis, and the subcutaneous layers, and knowing injections and the layers and like where they would be if like you had a picture or I asked you a question about it. I want you on the glands, there are the 3 different glands. I want you to focus on the sebaceous glands. And those are important glands. They come up, I'm pretty sure, in reproduction or child development maybe, or something pediatric, I'm sure. Something, it'll come in again. So if we can repeat it again, the more we talk about it, the more we make the connection, the more you're going to remember it. So that's, and it is an important gland. I'm sure you guys have all heard of it, but it has a lot to do with this specific gland. It opens up into your hair follicles. So obviously we have hair in multiple different places of our body, and this gland opens up in your hair follicle and will release, it's kind of an oily substance. I don't mean to be gross, but if you actually are ever sweating, just for fun, don't do this to someone else, do it to yourself unless you want to. But you can actually touch certain parts of your body, especially areas that are more enclosed, like your groin area, your armpit area, places that are more creased, and certain parts of those parts of your body that have hair follicles will actually put out sebum. And that's a special type of oily secretion that is secreted from the sebaceous gland. But remember, the key there is places with hair follicles. So how we're going to make the connection with why this specific gland does this, there is a reason. A lot of parts of our body do things for a specific reason. It's not just there just to be there. Hair has a function, even though we can make it, look good or bad, whatever we're doing. So the sebum that comes out of these glands actually has a component. So this is important. It has 2 specific special components. As I mentioned, it's an oily substance, so it is different than sweat. So if you felt sweat versus sebum, one's going to feel oily. It's a thicker kind of, I'm sure you've seen it or felt it or smelt it before. And it does tend to have a different scent, and everybody's different depending on their own bodies. Not always having to do with hygiene, just as a side note. But so this sebum actually has an not like a bunch, but a slight antifungal and antimicrobial aspect to it. And sebum usually will not become, I won't say effective. It doesn't really start coming around until about that time of puberty and the adolescent years, when somebody is going through producing hormones, basically. So puberty, or I should say specific hormones, like sex hormones. So this is also important. I think just to understand, this is not important as far as like test wise, but it's kind of, I hope it don't gross you out and you're going to be, oh my God, I have sebum everywhere. This is actually a part of pimples as well. So depending on what type of pimple it is, I don't know, we don't need to get into like the specifics of pimples, but some pimples can get infected. I'm sure you've seen the cyst ones and whatnot, but sebum can actually, if you have a buildup in your sebum, it can actually form into like a little pustule, I guess you would call it. As I had said earlier, I want to use those words. And there's sebum inside of it. And then interestingly enough, it almost like, I don't know if oxidizes is the right word, but once air hits it, it actually turns it black. And that's what a blackhead is. I just think that's fun information to know. You don't need to know that for any other reason than I think it's interesting. And you could like freak your friends out if you see that they have a blackhead and be like, you have sebum, and explain to them what it is. And specifically, now this part is important. If you get a buildup of sebum that becomes infected, that's called a pustule. So that's the exact definition of a pustule. So sorry about, I used the word in the wrong context, and I could say I did it on purpose, but I didn't. I'm human. So that is something that is important for you to know. Because this pustule basically, in simple terms, becomes filled with bacteria. Therefore, as we all, this can create an infection. And again, that can be small, or it can be big, or we can, depending on how we take care of it. So this next part, starting on page 1147, this is pretty basic because you've all done assessments. So we're not going to spend too much time on this. I think it's a good review, especially going back to clinical. So I would like you to take a look at, obviously aging in the integumentary system is very important. We all know why. I mentioned it earlier. I don't care if you're in a SNF or not. I don't care if you live at home. I don't care if you're in perfect condition. It doesn't mean that your integumentary system still may not be more susceptible to infection. Again, because skin can change. Genetics has something to do with it, all of that. But however, we need to be aware and be thinking of these types of things. Food can have how we're eating, our nutrition, our, all the things that we're intaking, as I mentioned earlier, smoking, I think I said genetics, but genetics play a huge role. I mean, I've seen people, my aunt is 70. I'm like, you're 70? Like, it's insane. Your skin is beautiful. No makeup, no nothing. And it's just like, wow, thank you. Please let that happen, right? So I do want you just to take a quick note here. On page 1147, there's this little graph on the right that says the aging integumentary system. And the reason why I think that that is important and that you should kind of take a special note of is to understand what happens to your skin as it ages. That's it. From this part, the little arrows. Take a look at it and understand it. If you can understand that, then you're good. Take special note. Obviously, we want to do the health history, all this stuff that it says here that you already know, the what's up. Have they been having any problems with their skin? Do they have any diagnoses with their skin going on? We want to be able to, we know how to do this. So just kind of review it. It's not anything that needs to be, it's not a dire situation. I would more you rather, that was not English. I would more rather you spend time on the aging integumentary system on page 1147. That's where I really want you to focus. Excuse me. And then down here on table 51.3, the subjective data, I think it's important just to take a glance at it, having to know as far as specific questions to ask. So I think I've mentioned this before in my clinical. So a lot of the, not a lot, well, no, a lot of the time, especially when we're newer, we get stuck and we're like, okay, I've asked them, how are they? What do I say now? So, and as we all know, I like to be able to have a conversation, and at the drop of a hat, is that this, whatever, you should be able to come up with something to ask them, hopefully that is meaningful in, what you're doing. And then if you don't, ask them something else. I don't know, like, oh, it's a nice purse, where'd you get it? Right? And until you can think, you might need to take a second to get back on track. So for example, here it says history. Do you or does anyone in your family has a history of rashes, itching, this, that, the other? I think that's very important. We're asking about their family. We're getting subjective data. So I want you to remember that, subjective data, and then kind of read through this and understand it and the rationale of why you're asking. Because, for example, many things can be hereditary. So I just basically told you what is the most important part is the first one, the first question about the hereditary, and then read, you know, the other stuff as well. But, and it's basically what I already said, you know, do you wear sunblock? Do you do this? Do you do that? So that light blue square at the bottom is also important as far as understanding what you're asking, why you're asking it, and then being able to do the patient teaching, right? That's the patient part, and that's where the patient part comes in. So, and again, I know this is stuff that you all know. A good review, and it's a good kind of reminder. And then we come to the physical exam. So when you turn the page, pretty much all of the blue, I mean, read through it, please. I think it's important. I think it's stuff that you already know because you've already done this. But then it talks about the physical examination as far as like looking through, and I'm pretty sure, I know the RNs, we've done this with them, but I'm pretty sure you guys have done it as well. Excuse me. The physical exam, you know, feeling the scalp, is there lumps, bumps, how does the hair feel, what's going on in here, are we equal, you know, all that kind of stuff. So pretty much from page 1148 from physical exam, we go to inspection. So I want you to keep special note of inspection. What does inspection mean? Why is it important? Why are you doing it? How are you doing it? Basically, if I gave you a patient scenario of you doing an inspection of a certain part of the body, having to do with the skin, for example, maybe let's say color. If I said on the test when we were talking about different alterations in the skin, I might say, you know, I might give you a little scenario and mention the word. So this might be a word that you should probably know with, which I probably will say wrong because I always do. I always say it wrong. Erythema. So you should know what that means, right? If I'm going to be documenting it or whatnot. So that, and definitely you have to do it. I'm sorry, guys. Jaundice. You don't have to know why the jaundice is happening, but you need to know what jaundice means. So those two terms are very important, especially when you're inspecting the skin, because when you're inspecting the skin, and this can be a pretty sensitive topic too. I mean, if you think about it, right, you're inspecting the skin, you might see a lot of bruising, you might see a lot of things going on where you're feeling a little bit uncomfortable to ask the questions. And we don't, in my experience, it's usually not best to jump to say, are you being abused? Why do you have so many bruises? Or I mean, maybe you might even say it nicer than that. It's kind of, we're trying to build trust, number one. Just because somebody has a lot of bruises, I have bruises. My dogs jump on me jump. If you play sports, some people just bruise easier than others. Anemia, all this stuff. It's okay to ask, like, oh wow, I see you have quite a lot of bruising on your legs, or if it's 500 degrees outside and they're wearing a lot of clothes, and then you notice a lot of bruises. It's okay to ask these questions. It's just it's how you're asking them. And I've said this to all of you. I'm sure maybe very few of you I've had in some sort of my class. So just being sensitive to that, I think, is very important. And other things like, I mean, people have moles, people have skin lesions. We have things that maybe we're embarrassed about, and somebody else looking at them or touching them or inspecting them, it's uncomfortable, right? And then you see them writing and you're like, what are they writing? So just kind of being sensitive to that, I think, is important. I think we can all think of a time maybe that it depends who you are, I felt a little bit uncomfortable because we've been uncomfortable with something that we have had to go to the physician about, or I mean, even just being in that doctor's, they call it a robe, I don't even know, whatever that thing is that they put on you, the gown that covers nothing. I mean, it's uncomfortable for most people. So kind of always, I know it's psych, but always keeping, the psych is important. And the psychological comfort of your patient is important. The more comfortable they are, usually the more they'll tell you, which therefore you can help them. Okay. Obviously, the moisturized dry, that's important. Edema, we talk about a lot. I am going to just kind of mark it here. Why why edema happens. Not like as far as what are all the reasons that edema can happen, but if somebody were to be documenting and they use the word edema, what does that mean? Okay, well, edema, as you know, is, I'm highlighting it as I'm saying it, because of excess fluid in the tissue. So edema, meaning that the fluid that is supposed to be in one part of the tissue does not stay in the tissue many times, because albumin, which is produced by the liver, not always, for the most part, this is usually why it happens. Depending on if it's dependent edema or whatever, but one reason edema can happen is because your liver's not functioning properly, you're not getting enough albumin. Albumin keeps everything kind of nicely compressed where it's supposed to be. So unfortunately, it starts leaking into the tissues. Now, am I going to ask you that exact question? No, but I might ask something about edema. And you should be able to know, every single person in this class right now, before I even ask that, if I said, what is edema? And I'm not looking for this, I would ask it as a patient. Oh, I heard you saying something about edema to the physician. What does that mean? And you can show them, on their, let's say it's on their lower extremities or whatnot. And you could actually show them and say, oh, do you see this little bit of, whatever word you want to use, this little bit of puffiness here, and you can press on it and say, do you see how when I press on it, it takes a few minutes for it to come back? It's because whatever, you have a little bit of extra fluid that is in the tissue, and you can nicely explain it to them, this is why it's happening. They might have congestive heart failure, whatever the reason may be, right? And then you do your patient teaching. So what is edema? It is fluid in the tissues. That's it. I mean, knowing that, good. We're in the right direction. And then we go further. You guys did cardiovascular. So what are we doing? We're connecting, and reassuring and remembering. Simple things too. I know, because like I said, this is not the most complex system, because unless you're going to be a dermatologist. Okay, so then we move on to palpation. Palpation really is more, honestly, inspection and palpation go together. You're inspecting while you palpate. It's not like the bowels where you inspect first, right? And then you touch it, because if you touch it first and then, wait, hold on, sorry. Just had like did I say that right? Yes. You look at it first, and then you're going to listen to it, and then you're going to touch it. And why do we do it that way? We listen to it first because if we touch it, we could change the results. This is a little bit different, unless like you maybe like scratch off like a huge zit pimple, or some sort of like you opened up like a wound maybe, but you're not going to do that because you're going to be very gentle. So palpation and inspection do pretty much go together. I would like you to understand the word of what the other word for bruising is. I think that is important. I'm not going to tell you what it is, but I think you should know it. And when I say I think you should know it, usually you should know it because we're going somewhere with that. From here, alopecia, that's one of your key terms, and we talked about that. I definitely do want you to understand, and I am going to read. Some things are just easier to read. So being able to know any areas of alopecia, which has to do with, it could be, hair loss in general, but usually it has to do with the fact of like true alopecia. If you're actually diagnosed with alopecia, it's usually when you don't have any body hair at all. So knowing that, I think is very important, especially for this topic of the skin or integumentary system. So then we move down to page on 1151. If you go to the bottom, we talk about laboratory tests and different types of cultures. And for the most part, usually the reason why we do the lab tests have to do with finding out the presence of viruses, bacteria, different funguses that might be going on in the skin. And usually that has to do with cultures. Sometimes they can do it with just like it is cultures, and then they send it and they do a laboratory test on it so that we can be able to know. If we don't know what it is, then we don't know how to treat it, right? So that we don't know the correct antibiotic or antifungal and whatnot. So that is important to know too. Why are we doing this culture of the skin if something's going on? So that we're able to identify what it is, and why do we want to identify it is? So we know how to treat it. What medications to give, what creams to give, maybe some directions to give them. I think I gave you maybe 1 or 2 questions from this, but on page 1153, I think it's important that you also understand the skin testing and how we do things for certain types of allergies, like the scratch test and whatnot. It's not that big of a paragraph. It's like that big. So please read over this. This is, I think, important just to know that it exists. And again, we'll go back to peds because we're in peds. You may get asked by, you know, a parent or someone, or, you know, what are you doing? I mean, we could do it to adults as well. It's not just children. But it's important to know why we're doing it. Many people are hypersensitive to things and not always allergic. It's just good to know. So I think it's again, another thing as a nurse to know. If a patient came, like me, say, okay, I'm working on psych one day. Let's say I'm covering, let's just say I'm covering addictions. It makes it easy. And someone comes up to me and they look like, or I'm taking their allergies down. Okay, what's your allergies? Most of the things they're telling me they're not allergic to, they're hypersensitive to, which means they're not going to have anaphylaxis. They're not saying if you're allergic to something, that doesn't always mean you have anaphylaxis, you know, pollen, all that. Like, but then we ask, what's the question? Okay, what happens when you take trazodone? Or what happens when you, because they might say, oh, I'm allergic to it. What happens when you take trazodone? Oh, it makes me, I feel groggy in the morning. That's not an allergy. I don't say this like this to the patient. That's not an allergy. You're sensitive to it. So then I can properly document into the chart. So I want you to read on page 1153 having to do with the skin testing. I think that is important, definitely. I want you to be able to answer this question. I know you guys do a lot with dressing, so I'm not going to, how would you say, beat you over the head with it. I want you to be able to know, if you were asked this question, why would you apply an open wet dressing? What is the purpose of it? So I want you to be able to answer this question. Why do we do it? Main reason, decreasing inflammation, but there's a couple more on here as well. Then we're going to go to my favorite part, which is medication. So then we are, again, still on page 1153, and at the bottom, it starts to talk about topical medications, which with the skin, obviously, not all the time. We can take oral medications as well, and different types of medications or injections and all sorts of things, drops. But for this particular part, it's talking about topical medications for the skin. As a side note, I want you to know what the word antipyretic is. Just want you to know that word. I think that is important. And also understanding that topical medications work different. So as I mentioned earlier, there's, you know, or I mentioned some, but there's ointments, there's cream-based, there's lotion-based, there's all sorts of different types of basis of ointments or stuff that you put on your skin. And a lot of that has to do with how fast it's absorbing into the skin, what it's doing to the skin, dependent on what your diagnosis is and what you're actually treating. So that's important to know too. So this medication that you're putting on your skin may be specifically given to you as your prescription because it does certain things, rather than your husband using it at home because they think it's going to work on what they have, which we already know we shouldn't be doing that anyway. But why again? Why? Maybe because one's an antifungal, one's an antibacterial, but they also work differently too. So if you kind of just glance over this, kind of ask yourself why as you're reading it. Why does it matter? And again, I'm writing this down because it might be important later. Why does it matter? And understanding, and I think it's kind of cool to understand too, like, oh, cool, this ointment was prescribed because it does this and it's time release or whatever. It's a really interesting thing to understand and to just have the basic knowledge. Again, you're not a dermatologist. Maybe you want to work in dermatology, so this is way more interesting to you and whatnot, but that's not what the class is. It's like being an OB. We're not, never mind. I digress. One other thing I want to mention about dressings on page 1154, there's this block about dressings and, like, you know, are they there for moisture? Are they there to make it to where moisture is having less moisture and whatnot? Understanding, I'm just circling it, just a basic understanding. And again, I know you guys know a lot about dressings, But what I really want you to look at is actually at the bottom. It's this nursing care plan for patient with an inclusive dressing. So I want you to just understand this, have a very good understanding of what this means. At the bottom here, I'll just show you. So down here, just being able to look at it. And the reason being is because it has to do with nursing care planning and whatnot. Even though a lot of the time we don't actually write out nursing care plans, our documentation of what we're doing is nursing care plans. Even though it's not the exact way that we're doing it, your brain will still absorb the information and be able to have you apply it to that area. So for example, here it says, nursing diagnosis is impaired skin integrity, okay, related to open lesions. This is gonna happen, this happens, we've seen it all the time, right? Expected outcome, the patient will experience improved skin integrity as evidenced by reduction in size of the lesion. Beautiful, that's what we want, right? How are we gonna do that? Evaluation of outcomes. Is there a decrease in the wound size? Boom. And then it talks about the intervention, the rationales, and the evaluation. So just having a basic understanding of this, even though I think you already do, I want you just to kind of take a look at this. You've probably already done this. Just take a look. If something doesn't look familiar to you, familiarize yourself with it. That's only one I want you to really look at as far as this. It is continued a little bit on page 1155 as well. Again, same, very basic things that you guys already know. Is the topical agent working? Is this working? Is this not working? It's very basic. So that's why I'm not going to waste your time explaining, or waste your time. Yeah, we won't waste our time explaining it because I know you've gone over it before. Let's see here. Talked about dressings, proper application. So dressings does go down to the bottom of page 1155 as well. You should know the different types of dressings that it talks about in the book. So the ones that we've already talked about. So open wet dressings on page 1153, and then just where it says just dressings on page 1154 that goes over to page 1155. There might be a question like, what is the difference between this and this? So knowing the difference between the dressings, is one trying to absorb the moisture, is one trying to put moisture in. Why are we doing this? So if you were in clinical today and you're helping a nurse doing a dressing and they're like, why are we doing this type of dressing? You want to be able to have an answer and know, well, this is why we're doing this, or this is why we use, what is it called? Oh my God, Anne, she would kill me. That stuff. I forget they use it at the VA. It's so helpful and it's so good with wounds. And they're one of the very few places to have it because it's not cheap, but it's awesome. Cannot remember the name. I know you're all probably sitting at home like, come on, Miss Amanda, get it together, and you probably know the name. Okay. And what I don't want you to stress about is on page 1156, table 53.3, where it says common dressings. This is where I don't want you to stress out. I just told you the 2 pages that you need to look at. You look at those 2 pages. Do not look at page 1156, this big old blue thing that talks about common dressings, and freak out. Don't look at that. I mean, you could read it, but don't look at that and think that I'm gonna have you compare and whatever. No, nope. I'm even putting an X through it right now. That's not what I'm talking about. Keep in mind though, the dressing part also goes over to page, just the very top page of 1156. So again, I'm going to say it one more time. Pay attention to page 1153 where it talks about open wet dressings. And then page 1154, 1155, and then 1156 have like little pieces on just dressings in general. That's what I want you to pay attention to, because those are where I would have you compare on a test or a quiz or whatnot. Okay, another thing, and then we will end this lecture. So depending on the what we're talking about, some things are going to be more of, teaching examples. So obviously if I'm talking about endocrine, we're going to be talking, I mean, there's much more teaching involved than like, this is the most basic part of integumentary. We're talking about inspection, palpation, like stuff you guys are already knowing. So it kind of seems like she's not teaching. So I mean, probably little things here and there and kind of more telling you what to know because it's going to be applicable for your tests, right? Because again, this is so basic Some of it might be new. I'm not saying if you don't know that you're not where you need to be. Just keeping that in mind. That's why this thing maybe not as much as a lecture, more of know this, know that, with little spurts of information here and there and examples. Also, it might be important to, as I said, in your for your what's that thing called? This thing, the workbook, to understand the. I want you to look at the review questions at the end and look at those. Take a look at those. Same thing with the book. So if you're assigned chapter, like right now, we just did chapter 53. Look at the review questions and know the answers, because I'm going to be pulling from, this is your book. You paid for this book. I want you to get the most out of your books. Doesn't mean your tests are going to be all from just these 2 books or whatever. I have Saunders, I have NCLEX. You guys know I have tons of different questions, but you will, as again, get your, I love study guides. I think that they're so important because there's so much information. Oh my God, especially once we get to endocrine and immunology. Oh my God, there's so much. It's just, I just personally feel it's nice to kind of know where to kind of steer you rather than you being like reading and then memorizing and then forgetting. Okay, so really that's all I have to say as far as this chapter. I will be on tomorrow. So if there's any questions, any concerns, anything that you want to talk about, even though I just said, oh, this is basic, this is, if you have questions or any concerns, even about just about the class in general, or just want to come in and say hi, that's fine. I will be on from 8 a.m. I will wait till 8:30. If I already said on another video, so I have to. So I'll wait till 8:30. If nobody comes on by 8:30, I'm going to sign off because it's not a mandatory class. Obviously I'm doing the pre-recording, but I also am going to do both, even though I don't have to, just because I think it's not fair not for you to be able to ask questions or clarifications or anything like that. So I hope you got a little something from this. If nothing else, just knowing what's important for you to know for this chapter, which is chapter 53. So we are going to end here. I'm going to upload this and I will send you guys the link shortly. Thank you so much. And remember, when you watch these videos, these are very, very important because this is going to help you a lot to know, not just from your study guide, but from what I'm talking about. I'm your study guide right now, but I will also give you a little bit just to kind of focus on. All right, guys, I hope you have a good night and see some of you tomorrow.